Hi, ARF.com. This is Dr. Stephen Brammeier from Kingsbury Animal Hospital. As we learn more about behavior and our pets, I'm often asked questions about emotions and if pets express or experience the same kind of emotions as people, like depression. Oftentimes I'm asked about depression when another dog in the household dies, especially if they've been paired together for a long time. And I don't know that we actually know the answer to that question if they experience what we call or classify or experience as depression. But certainly they react to changes in what's going on around them. And I do hear from clients that sometimes when a dog passes away and they've been really bonded to another dog in the house, that the dog that's left behind, they notice changes in that dog's behavior. They might go looking around the house at where the other dog had been or would be. They may have less interest in doing things and playing and stuff for a while and just seem more quiet and less energetic. I don't hear that all the time. I hear it once in a while, and I think that that's accurate. And whether or not it's classically depression or not, I couldn't tell you. But they certainly do respond and react, when another pet in the household that they're particularly close to dies, or if a person in the household, dies or moves away. The other time that it comes up is around really aged dogs, and with the kind of medical care and attention and diet and things that dogs and cats are getting these days, are living longer lives. So older animals, their behavior sometimes does change, and people say to me, like, my 14-year-old dog used to get up and greet me at the door every time I came through the house, came home, and now I have to go wake him up, or they're less interested in family members. And some of those things could be associated with partial hearing loss, which can happen to older dogs. Sometimes it could be associated with arthritis and maybe not being able to get up as well. But sometimes older dogs can have cognitive changes, just like some people can have disorders that have cognitive changes. And when that happens, oftentimes the dogs become less social, less interested in interaction with people. They isolate themselves more. They might start to have house-breaking failures that they didn't used to have. He hasn't urinated in the house for 12 years, he never did that, and now they're going to the bathroom in the house. Sometimes that can be a physiologic disorder, a bladder infection, kidney problems, or something that's changed their urinary habits, but sometimes it's cognitive and it's behavioral. Sometimes an animal like that will get tangled up in the legs of the dining room furniture and not know how to get out, or go behind the couch and not be able to get out. Or when you open the door to let them outside, they go to the wrong side of the door. Or they go outside to go to the bathroom and are kind of wandering around and don't always just come back in. And there's a medication that can help with that. There's a diet, sometimes it can help with that has more antioxidants in it. And so talk to your veterinarian. If you think that your older pet has behavioral changes that don't seem quite right to you, there might be something that could be done. I don't know that I would classify that as depression. I don't think I would, actually. It's a cognitive disorder. And whether or not pets get frustrated, the fact that they can't get out and run and play and do and experience life the same way they've experienced when they're younger, does that contribute to their emotional state? It's hard to say. But certainly I would speak to your veterinarian if you notice behavioral changes in your older pet, because there could be a medical problem, or it could be a behavioral or a mental problem as well. I'm Stephen Brammeier from Kingsbury Animal Hospital. We speak your pet's language as well as yours.